Hello, everyone. It's your captain speaking. Welcome to Flying Minds. In today's journey, we have a very special guest, and I can't wait for you to hear her today. Dr. Walters, PhD, is a registered psychologist with more than 30 years' experience helping adults, couples, children, adolescents, and families. After growing up in Montreal, where she completed a special care counseling program at a junior college, Diane moved to Calgary, started at Hull Child and Family Services. After a 3-year stint working in residential care with adolescents with diverse needs, Diane returned to university. She completed her undergraduate degree at the University of Victoria, her master's degree at the University of Saskatchewan, and then the University of Calgary, where she completed her doctorate in clinical psychology. Diane's broad experience has spread across many areas, including her private practice, Hull Child and Family Services and Woods Homes, the Eastside Family Center, the Foothills and Holy Cross Hospitals. Diane also provides services for the RCMP Health Services and Veterans Affairs Canada. In 1998, Diane's private practice joined forces with the Bridgeland Family Practice Group, which included Dr. Brendan Adams. Through this association, Diane began to work with pilot and air traffic control clients, which started her subspecialization in aviation psychology. Even though she is not a pilot, Diane has had the chance to fly in the jump seat on a couple of flights and has had the chance to do a ride in the simulator. WestJet has drawn on Diane's experience by asking her to develop presentations for training captains on simulation anxiety and on psychological factors involved in the pilot selection process. During COVID, Diane participated in the Mental Health for Pilots initiative that was created through the pilot assistance and pilot recovery programs. One of the things that make Diane a special advocate for pilots, in her belief and how she addresses pilot issues, is that pilots are people too, and all aspects of individual and relationship concerns that can impact a person can be dealt with in therapy. Both professional and life experiences allow Diane to be very effective, compassionate in her work with pilots. Her very strong self-esteem means that she's not insulted when a pilot client tells her that they attend sessions primarily to spend time with her Labradoodle, Murphy. So with all of that said, please welcome Dr. Diane Walters to Flying Minds. All right, here we are. How are you?
Fine, thanks. Thanks for inviting me.
Well, thank you for joining me. Before I get going, I have to say thank you for joining me. And also, before we get started, I want to mention to the listeners how you sort of set me in the direction of this whole mental health challenge in aviation. And you mentioned that, as we got talking, and this was quite a while ago. Mm-hmm. If I'm not mistaken, it was probably 6 months ago, before this even got started. You said, pilots are people too. Mm-hmm. And it doesn't just affect the pilot or the aviator, however you want to put that, but it affects the families, the children, the extended families, friends, colleagues. And that was a great piece of advice for me as I started to go down this road and started doing some research on this. And I've made it a point to include families. I did a great interview with a pilot friend of mine, and the next day I interviewed his wife. Couldn't do them both together because she was busy, but I would have done them together. And no, that probably wouldn't have been too good. Anyways, she let it all out, talked about how hard it's been. And she's been with this man for 40 some odd years. Mm-hmm. So anyways, I want to thank you for that. Okay. All right. So I realize there are multiple altitudes we could climb to. So firstly, let's talk about what are the common mental health challenges faced by commercial airline pilots.
Okay. And as I've often joked, pilots are people too. So they have the same sort of range of mental health challenges that all individuals have. The people that I've seen in my practice who are pilots, they show up with anxiety, lots of sim anxiety, depression, substance use. These are common amongst all people, are most common amongst all people, so they show up more, just as much with pilots.
Okay. So we're talking
Okay.
about all the different areas of stressors, I guess you could call them:
Yeah.
anxiety, depression, substance abuse. Is there a common theme in pilots that aren't common or more common than someone who isn't a pilot?
Well, it's the impact on their job that is unique to pilots. Um, and sometimes what contributes to their stressors that is also unique to pilots. So pilots have significant, like specific job demands. They have training requirements. They have, they relicense every 6 months. They're away from work. They have a very demanding job that they have to sort of be calm and then be ready to react. They they're away from home a lot. All of those kinds of situational stressors can impact their mental health. And then how that impacts their performance, because they are in a safety sensitive environment or situation, can then make it really challenging about whether you continue to work or not work, depending on what symptoms are being experienced.
And probably the level of stress or anxiety. I mean, I'm sure we all go through anxiety and stress on a day-to-day basis. So with pilots, it's probably some days it may be elevated. Like you said, some of the things that we in our industry, we would say our job is hours and hours of boredom with moments of sheer terror. So I guess it would depend on, if I do 40 flights or 50 flights and it's, same old every day. And then all of a sudden I have a week where I have to deal with weather and maintenance issues or mechanical issues or whatever. That probably elevates some of those areas. Do you see that? Do they bring that up, or is it what, when you see somebody, do they say, I'm depressed, I'm stressed, I deal with anxiety? Is there a specific area that you see most?
So I think it's helpful to separate the categories into two. I get a lot of referrals for simulator anxiety, which is, again, because it's specific to aviation. The stress of doing simulator it depends on the person. Not everybody has sim anxiety, but I've seen a lot of referrals for sim anxiety. So there's that's very specific. It shows up every 6 months. There's lots of anticipatory anxiety. It's especially difficult if there's been a history of poor performance or there's an upgrade and the stakes are high. So that's sort of one category.
Right.
Of where people are still very competent in flying. They say they have no anxiety flying. Their, overall mental health is fine, but it's one specific area that's still, that's a concern to them, and that they want to develop skills and resources to improve their performance in sim. The other category of referrals that I receive are, again, very kind of general. They can be situations where people are dealing with a grief and the grief is interfering with their ability to perform. They're not fit to fly, so they're on a medical leave while they're dealing with grief. Sometimes it's depression. Sometimes it's a different anxiety issue. Relationship concerns that are distracting can interfere with somebody's ability to fly reliably and competently. So then they might be on a medical leave for that or just want to address it. The fine line with pilots is whether or not the mental health concerns, just like physical health concerns, interfere with their ability to reliably and competently fly an aircraft. It's always that fine line. We, like you said, pilots are people too, and we all have better days and worse days. We have more challenges, and so you can have, had a tough day and still fly competently. But if the mental health symptoms are frequent enough and intense enough that they interfere with your ability to concentrate, to pay attention, to remember your SOPs, so that should something happen, you're able to kind of access all your skills and resources, or just in a regular flight, be able to still manage all the demands that you have in a very competent and reliable. It's really around the reliability of it. Can I count on myself to, be fully situationally aware? Can I count on myself to not get so distracted by whatever is going on at home or what's going on with me, that if I need to perform, then I know I can?
Hmm. So, so if a pilot comes to you, or what's the realization for the pilot that says, I'm not sure I can do this? Like, where does that occur? Does it occur at home? Does it occur at the job where they go, man, I didn't handle that very well? Or they just wake up and go, I just don't feel like I can do this?
I think, all of those situations have occurred. For some pilots, they have a flight where there's a sense of I ought not to be here, right? And then they reach out for a referral. Sometimes it's at home going, my sense of dread is so high that I really can't count. Like, I know for myself that I don't have, I haven't slept well enough. I can't concentrate well enough. I'm too distracted. I'm too upset. I feel overwhelmed. And so then they book off sick. And in those situations, or they call a pilot's resource team. Um, so lots of different ways that somebody might have a cue that says, I don't think I have it today.
Today isn't the day. Yeah.
Yeah. And again, it's about the frequency. If it's just one day and then, things settle out for that pilot, then they carry on. But if the frequency and intensity continues so much that in some ways it warrants a medical diagnosis, right? We don't get a mental health diagnosis just for having a bad day. We have a mental health diagnosis of depression or anxiety when the symptoms are pervasive. For depression, they're like 2 weeks minimum of feeling, host of cognitive and physical symptoms, and they interfere with your social, occupational, or family functioning. They have to interfere with your functioning.
So those would be some of the signs then that would trigger, I've got a mental health issue then.
Yeah, like I have a mental health issue that isn't just a bad day,
Yeah.
where, maybe I need to go for a run and maybe I need to meditate or maybe I need to have a chat with my spouse or, you know, um, but it's been, kind of, it feels like it's more chronic than that. It feels like there's a sense that, um, I wake up every day with this, high level of anxiety that, I can grin and bear it and get through the day, but it's not getting any better and it just seems to be getting worse. Um,
Hmm.
so it's those kinds of situations where, um, if, you came to me for an assessment, it isn't just, so do you have difficulty concentrating? It's to what extent are you having difficulty concentrating? Can you even read? Can you get through your SOPs? Can you, um, how's your short-term memory? How's your long-term memory? Like, there's very specific kinds of symptoms that we look at that isn't just, I feel off today. It's really, it's interfering with functioning. Things that don't interfere with functioning are subclinical. They don't require or don't meet a diagnosis.
So what would, so if you had somebody come in and said they can't function, short-term memory is horrible, how how long would it take? I guess it would depend on the individual. What would be the recovery? What direction do you send them down to kind of help them with that?
Mhm. Well, in my practice, most of the pilots that have been referred to me have come from CAMIs like Dr. Adams, Dr. Heller, sometimes directly through chief pilots from WestJet and Jazz or the pilots assistance team. So most of the time, by the time a pilot comes to see me, um, you know, there's a sense of whether or not a medical leave is required because of a sense of not being able to function at work. So then the conversation is a clinical assessment about what's going on, what the concern is, and then developing a treatment plan for that. So it's really a case by case situation. There is no situation that is just the same and that there's just this kind of
So it's not here, take this pill and away you go.
or, hey, you broke your arm, so you'll be off for 6 weeks and then you'll start physio and then you'll be fine in 12.
Right.
Right? That's the tricky thing with these mental health concerns, that they're very specific to the situation. How the symptoms kind of express themselves are different. And then the treatment plan is geared towards the individual. So sometimes if, um, you know, there are certain sort of treatment approaches that are more typically used for certain types of issues. So depression, we have cognitive behavioral therapy, but we also have mindful-based cognitive therapy, use a lot of things like meditation and exercise. And so we use a combination of things to address each issue. How the person responds to treatment, again, is very individual.
So you mentioned what, three different therapies?
Well, yeah, there's just lots of different modalities
Or
that
modalities, sure.
yeah.
Would you start with one with the individual and see how it works, or do you give them multiple different modalities?
So again, it really depends on the assessment and what the person has come in with. Some people have been in therapy before, have accessed treatment before, and have a certain have found success. So then you kind of continue with that. Part of the assessment is whether or not medication would be appropriate. So for some mental health conditions like depression and anxiety, an SSRI or an SNRI is
What's that?
so they're just antidepressant medications that affect the neurotransmitters, either serotonin or norepinephrine. And so when I first started working with pilots, which is over 25 years ago, pilots
I had no idea it was that long.
Yes.
So you started working with Dr. Adams in
1999. Yeah, 1999.
Oh, that's okay. Sorry, now I'm putting it all together.
Yeah.
Okay.
Yeah, when he was still doing CAMI and being a family physician a long time ago.
Okay. Sorry, I interrupted you there.
No, that's okay. When I began working with pilots, Transport Canada did not permit pilots who had been diagnosed with anxiety or depression to fly with medication. So if they were prescribed an SSRI or an SNRI, they were on a medical leave. And so depending on what they needed, if they needed that on a long-term basis, they would be off work. And then shortly after I started working with pilots, then it became because research improved in terms of the concern was really around side effects of medication. Some of the side effects of the older antidepressants would interfere with the reliable and competent flying of an aircraft, right? Drowsiness.
Oh, yeah, we can't have that.
Right? Distractibility, whatever, right? So then as the SSRIs became more prevalent and there was more research around the side effects of long-term use, then Transport approved one medication. Then it was 3 medications. Then it was 5 medications. And then now most SSRIs and SNRIs are approved by Transport Canada for use for pilots with mental health conditions.
Oh, okay.
Okay. So part of the assessment process is whether or not that's, whether um, that's a recommendation for treatment. Now, as a psychologist, I can't prescribe that. So then the person goes to their family doctor or gets referred to a psychiatrist for medication. But it becomes part of the treatment plan, right? You can do, psychotherapy and medication has the best efficacy for depression and anxiety in a lot of cases. Not everybody wants to go on medication. There's still a stigma around medication, especially in the piloting community. Lots of pilots don't know that medication is okay. Because for such a long time it wasn't. And there is a there is a long process around returning to work with an SSRI or an SNRI, but pilots are able to fly on medication.
So do they have to be on? So if they get prescribed one of these medications, do they have to be on it for a certain period before they're allowed to go back to work?
Yes, exactly. So the process is that the medication is prescribed, and it sometimes takes a little bit of time to get up to a therapeutic dose. And sometimes, depending on side effects, some patients need to be switched on to a different medication just to get the best therapeutic effects.
Right.
So basically, once the person is stabilized on a medication at a certain dose, then the clock starts. And because you have the requirement is to have 4 to 6 months of stable remission on the medication before being able to return to work. And then there's an assessment process at the end of that just to ensure that there aren't any side effects, that the person is able to concentrate, have good situational awareness, and that the mood issue is stabilized, right? So we're dealing with both.
How do they check that?
How do they check that? So often, basically, there's a report that is required for Transport Canada that is done by either a psychiatrist or the psychologist who has been working with the person, or both. Often with this medication, there is a need to be referred to a psychiatrist who does a comprehensive assessment and checks in to make sure that there aren't any side effects that could interfere with their performance, and that the mood issue is stabilized. Those two things go together.
So they see you or the psychiatrist or their doctor, medical doctor. They go onto this program where it's, like you said, 4 to 6 months. Then they get tested by the psychiatrist. Does it have to go back to the company and they say, okay, he's fit to fly, or they just give him the written letter and say, okay, you're good to go, and then he tells the company, I'm good to fly?
So this is a process by which, so the reports written by the psychiatrist, the reports written by me, if it was, or the psychologist, go to the CAMI. The CAMI sends everything to Transport Canada. Transport Canada reissues the Cat 1 license. And then once that is all done, then the company gets a call and says, I'm ready to come back to work. And then often in those situations, then the pilot has to prepare themselves for ground school and
if they've been
sim ride.
Right.
Okay.
They have to go back recurrent.
Yeah.
Okay.
And, the process, so that's in some ways, the quickest process would be 4 to 6 months. We have to, there are times where the person hasn't reached stable remission after 4 to 6, it can take longer than that. Treatment sometimes takes longer than that. So it isn't a guaranteed 4 to 6 months, but if medication is prescribed as part of the treatment, then it's at least 4 to 6 months.
Wow. That in itself would probably cause anxiety and stress because now they're on long-term disability and they got to try and find something to keep them busy.
Hmm. I mean, there's recovering, and the treatment process sometimes is a job.
Yeah.
There's a lot of um, there's a lot of work involved, whether it's you know um, doing readings or exercising, yoga, um, taking care of yourself, getting your sleep back. It really, again, it's such a case by case situation because it depends on what the content and the process is.
Right. How often is, and I've read this or I've seen it or I've heard it on another podcast, exercise is one of the best medicines that you can have.
Hmm.
Does that vary from case to case as well? Or does that always seem to help? I know that's kind of a general, broad question, but
Well, um, I really think that if we look at, um, the fact that we all have mental health and we all have to get better at taking care of our own mental health in a proactive kind of way. And one of the ways that we are able to do that is to take care of our happy hormones. And we have four happy hormones, and one of them is endorphins. And endorphins are released through exercise. We have oxytocin, so we get to hug people and pet our dogs. We get oxytocin from that. We get serotonin, which is the here and now pleasure. So when you're really in the moment and really focused on what is happening right in the moment, then we release more serotonin. And then dopamine is the anticipation of pleasure. So when we have things to look forward to, um, then there's more dopamine. So those four happy hormones, if we can do those, and if we're exercising, getting good sleep, planning things, um, and we have good social supports, then we can help mitigate, the everyday and sometimes extraordinary stressors that we might be facing.
hmm.
So because exercise is something that's within somebody's control in some ways, it's one of those things that can help help to reset people.
Yeah, I probably use that term way too much with my kids. You need to exercise. Um, the happy hormones, social networks, that's a big thing too.
Absolutely.
Like how important do you find that for treating some of these areas?
Um,
Because there's a lot of people that don't have hobbies or they don't have a social network, and that's one of the problems with being a pilot is that we're gone and then we're home and then we're gone and then we're home. So
mhm,
their social network isn't as prevalent as, say, yours.
mhm. Well, I think that, one of the complicating aspects of being a pilot um, and again, everything I've learned from about, aviation and the life of a pilot is through my pilots because I'm not a pilot myself. But one of the challenges is that um, there's so there's so much scheduling in a pilot's life, in terms of what time they have to wake up, what time they have to show up, all the flights, all when they're away pairings. That I find that they come home and they don't want to do anything. They don't want a schedule. They don't want a plan. They just want to relax. And then they just get ready to go back to work. And what the downside of that is that they don't make plans, so they don't see friends or they don't go outside to exercise, and at the end of the day, it's like, "I did nothing today." And so they lose out on the serotonin, they lose out on dopamine, they lose out on the social networking because they're so tired and because and this is especially the older the pilot gets, it's like they need more recovery time. So they work, they use their days off to recover, they work, they recover, and they lose out on all that pleasure stuff. And so part of what I've often had conversations with pilots is make plans, have a nice recovery day where you do whatever you feel like you need to do. Do your laundry, sleep in, go for a walk,
lie on the couch, watch Netflix, do
right?
whatever it is. Right?
Do whatever it is. But for your next day, make a plan with a friend. Go for a bike ride, go for a hike, take your spouse out for lunch. Make a plan so you can look forward to the plan. If you don't have a plan, we lose dopamine, right? And if all you're then thinking is, I've got 2 more days and then I have to go back to work, then we have an association with something that's kind of more stressful and it's not balanced out. We want to keep balance. Work is stressful. Most, pilots aren't the only ones with stressful jobs. And so, we all have that kind of, night before work going, ooh, I've got work tomorrow and I have to get my head in the game. But it helps if you've been able to kind of enjoy yourself on your days off. We have a different mindset about work. It's just part of life and it's not easy. But I've had a nice lunch with my spouse and I've spent time with my kids and I've gone to the park or anything that can create a dopamine and then, for your next set of days off. And not even just for days off. I have often talked to pilots about, so what's the fun about working? Are you looking forward to watching a show in the airport or is there a place that you can run outside of depending on what your layover is? There are ways of kind of sneaking in both serotonin and dopamine through those kinds of planning activities.
It's very individual dependent. You've got to make sure you do that sort of stuff. Myself, for example, I'm in Toronto and I stay by the airport. When I've got time, I get my butt out of the hotel and it's very industrial, but I go. I just walk and I don't have a plan. I just keep going. And it's not very scenic, but that's something that I find just getting outside, getting the sun really helps.
Yeah, absolutely.
And it puts all that, the stuff through the day kind of behind you.
Yeah. And I think, likely because you've made it a routine, then you don't have to spend a lot of time thinking about it. One of the beauties of routines is it reduces the amount of executive functioning energy you need to have. It's not like, what do I feel like doing today? Right? You probably don't.
Functioning. Say that again.
Executive functioning energy. So, in our frontal lobe, we make a lot of like our decision making and our planning and organizing. When things are routine, then we don't have to think about them. It's just kind of easy.
Like brushing your teeth.
Like brushing your teeth. Or if you have the same breakfast, my family always jokes, I have the same breakfast every morning. I don't have to think about what I'm going to have in the morning. I have the same breakfast. People who do things by routine they sort of conserve their executive functioning energy for things that kind of matter, different kinds of things. So if you have a plan to, every time you go for a walk, then you're not asking yourself, what do I feel like doing? Do I feel like going for a walk? Because sometimes you might say, no, I don't feel like going for a walk. And then at the end of the day, you'll say, I should have gone for a walk.
Yeah.
Right?
Yeah.
So, that's just a simple kind of example. But when you do things as routine, every time I'm in I have a layover that's more than 8 hours, I'm going to go to the gym and if all I do is walk, if I can't walk outside, I'll walk inside. But I'll do something. Then when you're there, you're not asking yourself what you feel like doing. You're just following your plan.
Right.
Right. And so things like that we make routine actually help our kind of, help ourselves do what we need to do, whether we feel like it or not. But at the end of the day, we're always happy that we did.
It's interesting. I've never thought of this sort of stuff as like the dopamine and all of those areas. When I used to fly overseas, I would get to Tokyo or Osaka or Brisbane or whatever. And it wasn't something that I would say, okay, I got to go. I just needed to move because we sit so long, right?
Mm-hmm.
You're in a aluminum tube for hours and hours and hours. And the first thing I want to do is I just need to walk. I just need to go get some air, some real air. So I guess unbeknownst to me, that was what I needed in the first place.
Yeah. Yeah, and so, you knew what you needed, you knew what felt good, right? And so you did. So it was rewarded, right? Yeah.
Yeah, but it wasn't something that I consciously said, I'm going to be rewarded for this.
Uh-huh.
I just had to do it,
Yeah.
right? And obviously, when you're on the other side of the clock and you're in a, you have to cross the international date line, you get to where you're going. For me, I always would try and get on the clock wherever I was. So if it was late afternoon and I hadn't done anything, okay, I got to move, I got to exercise.
Mhm.
Then I would make sure that I was ready to go for dinner. Then I would go for dinner and I'd try and go with a group of people. So there was the social network.
Mhm.
So it's always available to the flight crew. It's just obviously an individual thing instead of just going to your room and sleeping. Yeah. Hmm. Well, that's really interesting. Um, so is there any specific aspect of our job that causes more stress or anxiety than another? Like, is there anything specifically? And you mentioned sim anxiety.
Mhm.
Is there anything outside of that, or is that pretty much the most prevalent one?
I think if we're looking at, what are the risk factors to some mental health concerns, um, the job, the job demands, like you just talked about, when um, we have, the issue of taking long, being in different time zones, going up and down a lot, and ending up in Tokyo and then having to readjust your circadian rhythm to someplace else, and then you're waking up and, if you're based in Calgary, it's really 2 o'clock in the morning, and now you're having you're somewhere else, and you have to kind of adjust your body all the time, and you have sort of a chronic sleep debt. We know that a chronic sleep issue can be a risk factor for other mental health concerns. So I think it's those kinds of job demands of that can make a situation worse and might lead to more concerns around whether or not the person's fit to fly.
Hmm. Yeah, I always had a rule for myself is sleep when you're tired, eat when you're hungry, but try and get on their schedule.
Hmm.
Although I do have several friends that would try and stay if they're only gone for say 3 days,
Hmm.
they would try and stay on their home schedule if they could,
Hmm.
right? So if it was 2 in the afternoon, they'd go to bed and then get up, 6 hours later, and then it'd be in the middle of the night.
Yeah.
But then you've got food issues. You're up in the middle of the night and someplace that doesn't have a 24-hour restaurant makes it harder.
Hmm.
So these are some of the challenges that, crews that fly overseas or fly long haul
Hmm.
have. Um, so let's talk about the consequences.
Hmm.
So, what are some of the consequences of reporting issues to your CAMI or to your mental health, or your general practitioner?
Hmm.
Does that come into play at all? Like, is that something that you say, well, we need to talk about this, you need to report it? Let's talk about, pilots suffer in silence. They have to report stuff like this.
Hmm.
Do they often bring it up with you, or and is it kept away from everybody else? Do you, what do you see?
Well, as I said, most of my referrals have come from CAMI, so it isn't something that is isn't aware at the kind of medical level.
Okay.
Okay. Again, I can only speak to the pilots and to the situations that I've encountered myself. You talk about silencing and, suffering in silence. This is a tricky thing for mental health concerns for a lot of people, not just pilots. There are times where I've shown up at work and at the end of the day thought, I probably should have booked off today. And because, and not, again, it was just one of those situations where I thought I could make it through, and I did. But was I at my best? No. And I don't have a safety sensitive kind of situation. But we have situations like that where it's hard to judge sometimes. We're not always the best judges about whether or not we can, we're at our best in terms of performance. But it's tricky sometimes. We're talking about situations where the frequency and intensity of symptoms are interfering with our functioning. People often think, I think I'm okay. I think I'm okay. I think that was an off day. I think I can, I can do it. And then sometimes, something happens where they nod off at work, or they really realize, like, no, I'm really not okay. So then they see their family doctor, and they, or they go to their CAMI, who says, no, I think you need to be off. So it is tricky. I think sometimes pilots have, struggled with some aspects of mental health symptoms for a long time before they're on medical leave. But I often think, because it's a tricky thing, it's not, and what makes it also tricky, is, the whole sense of, I'm going to be off work, and nobody wants to be on a medical leave for mental health symptoms.
Yeah.
We'd all like, so I think there's that fear of being off work, fear of the financial repercussions, fear of the unknown. What does this mean when, if I go off, how long will I be off? All those uncertainties come into play about whether or how long it takes for somebody to say, hey, I think I need some medical help here around my mental health symptoms. Physical health symptoms tend to be a little bit more clear cut. If I've just had shoulder surgery, then I'm off. And
Yeah.
there isn't the sense of uncertainty around it. There's a real predictability. Mental health is always a bit more complicated.
Is it complicated because we don't know enough about it, or is it because it's not reported enough? Is it because people don't want to talk about it? Like I brought up the suffer in silence thing. The first time I heard it was when I started, before this podcast started. I was talking to, some colleagues and some friends of mine about pilots suffer in silence, and that was actually said to me. And I kind of said to myself, I've never even heard that term. Where does it come from? What? Do you have any idea why that term would even come up? I know that's kind of a obscure question, but
Well, I think especially before Transport Canada approved the use of antidepressant medication, it was very black and white. If you had if you required medication, you weren't able to fly. It was pretty clear. And that could be a permanent loss of a job, not just a temporary medical leave, because they weren't approving anybody to fly on medication. So now it's very different. And so now I think there's still a social stigma around mental health in our society. There's a sense of, weakness, or I should be able to get my stuff together, It feels very personal. It feels like you're exposing something that's more personal. A shoulder injury isn't something that you can't talk about at the gym or, with your crew. But hey, I'm having trouble with my spouse, or, I'm going through marital separation, or my dad has just been, diagnosed with Alzheimer's. And, there are lots of situations that are just really tough to manage. Again, the specific aspect of being in such a safety sensitive job is that anything that could potentially impact your occupational performance has a different level of scrutiny, if you want to think about it. Right. So that's what's very unique more unique around aviation than even other kinds of safety-sensitive jobs like being a police officer.
Well, which they have. There's a lot of stress there and PTSD, and there's a lot of areas that they have that we don't as pilots.
Mhm.
Or they might be related, but in a different way, well, I'm sure.
Yeah, no, there's some commonalities for sure. The and they have their own kind of medical procedures around, their fitness to duty,
Mhm.
right? Um, so it isn't just for pilots that there's so much regulation, but there are different levels.
Yeah. I want to talk about, if I may, and you may not want to talk about this. One of the reasons that kind of pushed me to start this discussion or brought up in the podcast was suicides.
Mhm.
And this friend of mine that called me and said, you've got to get this podcast going. There's a lot of stuff we talk about. And maybe we are talking about it, but it's not loud enough. And because he had a couple friends that had committed suicide. The first thing I said to myself is, why? How does it get to that point? Is it because they don't recognize that it's going down the dark tunnel and they don't seek help, or it just overwhelms them? Is that something that we can address?
Yeah, we can certainly, suicide is, um, the tragic outcome of a depressive illness. Um, and it is, again, a situation that is best understood case by case, and it's difficult to understand from the outside because it often seems unimaginable that that would seem like a reasonable choice and a reasonable decision. And it's so tragic and so final.
It's heartbreaking. When I heard it, I was like, I couldn't believe it. Why? And that's the first thing I said to myself. Why? So sorry, I interrupted you there.
Hmm. Oh, I mean, it is a very common reaction because when, um, and especially if you haven't experienced a severe depression, it seems unimaginable to be in that level of distress where that would make sense. And, if you talk to other psychologists and psychiatrists, they may have different views on understanding the process of how somebody comes to make a decision around suicide. Um, I think at the extreme end of a depression, it it often is sort of the only way that the person can imagine feeling less pain or being out of pain. Sometimes there's a sense of I'm protecting everybody from myself. I am such a horrible person that this is the only kind of reasonable choice, and it makes sense to them. So from the outside, it seems almost it's hard to imagine that this could make sense because there's such a negative impact on everybody else, colleagues, family,
You mean how it
children,
affects everybody else?
everybody else.
Yeah.
So, how can a person think they're protecting everybody when the legacy that they're leaving behind is so tragic? But that's the impact of the depressive illness. Depression changes how you think about yourself and the world and everything else. We have, a significant sense of helplessness, hopelessness, distress, and it seems permanent and unending. And suicide is um, is a possible end to that suffering.
Hmm. What signs would you see? Would there be signs that you'd see prior to somebody going down that deep, dark tunnel?
Well, certainly some people um, share their thoughts with people. There are, and sometimes in an outburst kind of way. I think I'm just going to kill myself. That doesn't mean that they're planning, but often anytime somebody is significantly and severely depressed, there's, if you see somebody like myself, there's risk assessment and checking in around, how severe the symptoms are. Um, so, but it is very difficult to kind of discern because some people um, ask for help, but a lot of times they don't. Um, so you may be seeing the other kinds of signs and symptoms of depression, whether that is, irritability or a sense of being overwhelmed or um, withdrawal from social contact. Um, for some people, they actually feel better when they're making plans. This is the trickiest thing. So sometimes if a person has made a decision to complete a suicide, then you see kind of like an improvement in their mood, and everybody around them is like, whoa, cool, this person is feeling better. And
So
really,
they fake being okay.
they're not, I don't even think that they're faking. I think that when they have, say you're trying to make a decision that's really tough for you, right? And you finally have made the decision. There's a sense of, I've made the decision, right?
Oh, wow.
So sometimes there can be what you may be perceiving as, an improved mood might be, I've made the decision. And that's really shocking and tragic for people.
So
Yeah.
once they make that decision, does it change something inside of them when you start talking about all these happy hormones? Is there something that changes inside of them when they go, I guess you wouldn't know that, or maybe they do. They go, okay, I've made the decision to end this.
Yeah, I don't know if it has a happy hormone issue other than, if you can anticipate feeling less pain.
Hmm. Is there a hormone related to feeling less pain?
Oh, I don't know. I would be speculating. There's an anticipation of relief. I don't think it's anticipation of pleasure.
Wow. I don't even know what to say to that. It's pretty sad.
It's absolutely sad.
How about we just take a break for a minute?
Sounds good.
Thank you, everyone, for listening to Flying Minds. If you liked what you heard today, send me a message to chat@flyingminds.com, or you can view our website at flyingminds.com. I'd like to give a shout out to Grizzy Graphics for all the work on the logo, and to Evan Baldwin, who can be found at TTV_Valence for his help in editing and website design.
Yeah.
Okay, so back to, we've talked a lot about areas of concern, depression, anxiety, stress, and, pilots having to book off for, 6 months, 3 months, whatever it is. What's the process to go back to work? What has to happen?
Well, the first thing is that the person is stable, and basically in stable remission is the language of the mental health concern. So again, when we're talking about symptoms and we're looking at intensity and frequency, basically we're looking at a decrease in the intensity and frequency of the mental health symptoms so that um, they're no longer interfering with the person's occupational functioning or social functioning or family functioning. So again, this is a case by case basis because it shows up so differently for everybody. But when there is stable remission, so with medication, it's feeling well on the medication without any side effects. Even without medication, it's still, I'm doing well. And often the way that I test people, because if they've been off for a while, it means that they have to go back and do ground school in sim. So I get people to start studying because studying is a really good indicator of organization, planning, concentration, attention, memory. How's that going? Are you following your plan?
Do you have specific questions to find out whether or not they have?
Well,
Because you wouldn't know whether or not they've studied the SOPs or they're
no, but it is part of the thing, part of, you know, some of the homework is, sometimes reading homework, not always like around, getting ready to go back to work, but sometimes just regular reading. Because if people can't read an article because their distractibility is so high, then we have to we do those kinds of tests.
like any reading,
Sometimes,
or get them to
yeah,
read company memos or
yeah, no, just any reading, like,
like a novel or something.
yeah,
Okay.
exactly. Just read for a half hour a day and see if your concentration is returned. Most people are really honest. I don't worry about people underreporting to me or saying I'm ready to go when they're really not.
Well, that's a good sign.
Well, I think it's, my experience is that pilots take their professional responsibility really seriously. And especially when they're well supported by their family docs, by their camis, by their companies, they don't get hassled by the company if they're off work. What they find, what my pilot clients find the most distressing is the insurance company. The insurance company, because they often check in and they say, how are you doing? Are you following doctor's recommendations? When do you think you're going to be ready to go back to work? It's very difficult for somebody to answer those questions when it's a mental health concern. It's often, I don't know, talk to Diane, is the best response because, this isn't a shoulder injury. I can't tell you if in 6 weeks I'm going to be ready to go back to work.
Right.
So that's an added stressor around this return to work process. So I just get my clients to try to, circumvent the insurance company to me so that they're relieved of that kind of situation.
So
But
they
I find most pilots, they'll tell me if I'm not ready, if they're not ready, they will say I'm not ready.
So will you get a letter from the insurance company or somebody call you and say, "Hey, Joe
Yeah.
Blow here is we need to know what he's doing or how is he?"
Yeah, exactly. It depends on the case manager. Again, it's a case by case basis, but sometimes I'm asked to write a letter every 6 weeks or so in terms of the anticipated return to work and when the next assessment is going to be. Mhm. Yeah. So when a person is ready to return to work, like they're in stable remission of the mental health concerns, then typically I write a letter to the CAMI. That letter and all the other kind of information required by Transport Canada is sent to Transport Canada. Transport Canada then reviews that and either asks for more information if needed, or reinstates the Cat 1 license. Then once that part is done, then there's contact with the company around scheduling ground school and sim ride.
Right. That's one of the areas that I've had several people that have had been off on medical. One of the most stressful parts was getting Transport Canada to get the board to approve the Cat 1 license.
Mhm.
It's a long process.
Yeah, I think that, there are often delays. The person is ready and they're waiting to hear. Um, and
Which
I,
causes more stress.
which of course causes more stress. Yeah. People are, they want to go back to work. And so then they just do their best to kind of maintain things and, um, maintain the good habits that they've developed and continue to study and prepare a bit for ground school and um, and do what they need to do while they're waiting. Um,
And it's if this young man that I know, he's not young, he's not too far from my age. He was off for 3 years. And if it wasn't for the support he got from his flight operations chief pilot, the chief pilot was excellent with him. Said, "Hey,
mhm.
we'll help you through this, and speaking of insurance companies, he had a problem with the insurance company, and it was the chief pilot that got a hold of the insurance company and said, "Hey, you got to stop this."
Mm-hmm.
Okay. So, and then he was ready to go back to work, and it took, I think it was 3 or 4 months before he actually got the approval
Mm-hmm.
because it was going through all the processes or processes or whatever you call it.
Mm-hmm.
So it makes it hard. Yeah, it's a tough issue for sure because there's so many hands involved.
Yeah. You know,
Anything else you want to touch on that?
well, at the end of the day, everybody involved, from the pilot to, you know, family physicians to camis to psychologists who are involved to the insurance company and to transport, are wanting to make sure that the pilot is healthy, that there's attention to the safety sensitive nature of the work, that everybody is safe, that the public is safe, and they take that kind of responsibility seriously. I don't
Mhm.
think anybody, from transport all the way down, takes that responsibility lightly. Um, when it comes to a lot of the mental health things, because it is tricky, right? We're all on a continuum of stress. We all have demands and we all have emotional issues that we're dealing with. Um, so it gets a little tricky about where that line is around, are you still able to perform in a reliable, competent way, or are these symptoms starting to interfere so that you need a break, get well, and then go back to work?
Mhm. Yeah, I just hope that, you know, all these specialists, including yourself, or a psychiatrist, psychologist, your family doctor, or heart doctor, whatever it is, all these reports are made. And I've heard that, it goes to the board or goes to transport, and they go, no, we want more tests, but they've already seen 5 specialists. So maybe that's just a case by case basis too. I don't know.
I think it's a case, certainly, in those kinds of situations, if there's like, you know, more tests, it depends on the nature of the symptom. There are situations where people describe having foggy brain, right? Now, foggy brain is a euphemism for I'm having trouble concentrating, I'm not thinking clearly. It's really hard to know what foggy brain is. So, again, that's a case by case situation. Um, Sometimes it can kind of reflect more of a medical issue than I'm having sort of depression or anxiety kind of issue. So then there may be a request for a referral to a neurologist. Now, in this day and age, and with our healthcare, a referral to a neurologist might take up to a year. So that can be really frustrating for a pilot who might no longer be experiencing foggy brain because of their, the treatment or that they've had so far, but they're still having to wait for this referral. So those are the situations that are a little tricky,
Mm.
that are sometimes hard to understand from a pilot perspective. But again, when you think about that, um, you know, there's there's a sense of, sometime, well, there's a sense of wanting to be cautious, wanting to create certainty as much as possible, and trying to do due diligence. And it's, it's from that positive intent that a lot of these requests are being made.
Right. Right. Um, so let's finish off here today with one other question for you. Training programs. What do you see, or how do you feel, what needs to be enhanced in training programs to better address mental health issues in the industry? What are some of the areas that you see that
Hmm.
starts a lot of this problem?
Well, you have to think about just how intensive the training process is for a pilot. And again, I'm not a pilot, so I haven't had to go through all those kind of steps, from, flight school to your commercial pilot's license to all the, training for a specific aircraft and then all the sim rides and all of that. But you have to imagine that all of that, people are doing that because they're very invested. They're invested financially. They've invested a lot of time, a lot of studying. And so going into these training events is a pressured environment. There's a lot of pressure. People want to do well. They want to be successful. This is really important to them. And they're in a situation where somebody is evaluating their performance. And often training events, what some people have described to me, feel very more critical, that they're not allowed to make mistakes, that there's a sense of being personally shamed for making mistakes. I've had somebody tell me that, this is a pilot who transferred to another company after being a pilot for 10, 15 years, had lots and lots of hours, and during a training event was told, maybe this isn't for you.
And why did that person feel he had the knowledge to say that?
Again, there's either a mistake made during a maneuver, during a training, it wasn't a ride, and said this. And then, so then there's a sense of, well, I have to study more and I have to do more. So then there was just all this increased anxiety. And so, of course, we have an anxiety performance curve where it's helpful to have some amount of stress so that you can heighten your performance. You want to care about performing. You want to study well. You want to be alert and put in effort. So if we were scaling stress from 1 to 10, the best performance is around a 4 or 5. But we also know that if your stress level becomes distressing, so more like 7 to 10, your performance actually goes down. You tend to make more mistakes. You're more distracted. You're worried more about what the evaluator is thinking than what the plane is doing and what you have to do next. You miss where you are in the SOPs. Becomes really kind of concerning. And then the next time you go in, you're even more anxious. And
so it's an external factor that caused it.
Right. Yeah. So then when you talk about these training situations, training the trainer and in terms of being aware of how much power and influence and these offhanded comments that may have been just said in a moment of, I don't know, frustration sticks with people. And they sticks with people like negative cognitions. They become part of their belief system that then they have to recover from. But because they're going back into that pressured environment, and then they're going into another pressured environment, and now here's your PPC, and you have switched from one company to another, and now you might lose your job. Yeah. You might not even pass because you know what? Maybe you're not cut out for this.
That's just so unfair.
Right. So I think it's the sensitivity. It's like, that evaluators are in a position of power. They have somebody who really cares and cares what they think. And if they could become more positive coaches, like certainly people make mistakes and, that's how we learn. And let's kind of figure out how to, train you to standard. And not everybody may be cut out to be a pilot. And that's the, a strong responsibility. So again, you have to kind of focus on, what the person's ability to perform to standard is. But there's certain ways that we can promote good performance, right? And if there was the intent to promote good performance, to teach to standard, to, say good job, and when there is a good job, it can really make a difference about just how much anxiety and fear and worry the person brings with them into the training event.
It's interesting you should say that because I've seen, as an a full-time instructor now, and I've been doing this a long time. You can have two candidates come into the briefing room, and you can tell right away who's nervous and who isn't.
Mm-hmm.
And, you just sort of start asking personal questions. How you doing? What's your name? What were you flying? Or maybe you've had them before. I don't know. Or maybe they've been with the company for a while. Sometimes those small little conversations really kind of helps bring that stress level down.
Mm-hmm.
And the other term that I use, and I use it quite often, is you're here for training. You don't get to do this a lot. You're going to make mistakes. Okay. I'm here to help you. And I want you to enjoy your emergency. And they look at you and go, enjoy your emergency? I said, yeah, you got to enjoy it. If you make a mistake, we're going to talk about it and we'll do it again. End of story.
Mm-hmm.
And they kind of look at you and go, well, this is better. So the ones that have probably had a facilitator that wasn't quite so friendly.
Mm-hmm.
Maybe I'm too friendly sometimes.
I don't know. I mean, my guess is that the pilot still has to meet a standard, and the environment that you create can be friendlier to their nervous system, which promotes better performance. So.
Well, I've heard the stories, and I've heard lots of them. Guys say, yeah, well, the last instructor I had, he just yelled at me. Said, okay, you should know better than that. It doesn't help. Then they get on edge, right? Like you said, you start training from a negative aspect or from, putting that pressure on them right away. They won't perform.
Mm-hmm.
They've got to be relaxed. Mm-hmm. And I can say from all the people that I've trained, that guys that come in and are relaxed perform way better. Mm-hmm. Way better. So that's an area that I think, a lot of companies should look at. I know at some of the companies I were at or have been at, we had to bring on instructors because we need more instructors. Mm-hmm. So this guy's got 10,000 hours. Let's make him an instructor. And then you find out shortly after that maybe he's not cut out for instructing. Might be a good pilot, mm-hmm. but maybe not a good instructor, mm-hmm. which is different.
Yeah, I'm also always curious about whether there's a train the trainer process in terms of how do you give feedback? How do you, what's the job basically besides evaluating to standard?
Well, the company that I work for now, they have a 2-day program where it's train the trainer. And my boss is fabulous. And he really gets into, how do you evaluate? And, every event doesn't have to be, beat them up. Let's train this. What are we training? Mm-hmm. Some individual might have an issue with one part of the training. And if you're always hounding him, he's never going to figure it out. You just need to figure, okay, what is it? Back it up. Why is he doing this? Mm-hmm. Let him relax and find out where he's making the error. A lot of guys say, oh, well, he can't do it. And he marks it off as a 2 because he didn't do it properly. So, well, there you go. Well, I think we are done for today. I just want to say thank you very kindly for coming in. I know this is something different. It's different for me. And I really appreciate you taking the time.
Yeah, well, thank you for asking me.
And maybe we'll do this again.
Maybe we will.
And thanks to everybody out there, the Flying Minds listeners. Tune in, subscribe, or take a look at our website, flyingminds.com, or send us a message, chat@flyingminds.com. Have a great day.